Yes, indeed, COVID has impacted my relationships with people. I have got to know people at a deeper level, which has made me realize that I am not comfortable with some people and I am actually very fond of others. I was unable to feel this before COVID lockdown happened because the time and energy which I was putting into those relationships was less. So, yes, it has impacted my relationships both in a positive and a negative way.
Yes, it has impacted. Like at home, since I'm working from past 2 years, so the relationship with my parents sometimes gets sore because uh, I want to hang out in the night with my friends, and they don't like those things, and then there are few differences, and also like they expect a lot of things to be done at home from me, which I don't like to do, and I also want independence at home as well. Like I want I want to be isolated for some period of time, which I don't get. So that actually impacts the relationship with my parents and with the people with whom I work with.
They were friends who were living in such far off places, and normally I would not have talked to them, have had such long conversations. But just because of the fact that even those far off friends were having the same shared experience of being locked down, being stuck in their homes, it gave me an opportunity to reach out to these friends. And I remember I had many group conversations with these friends, and overall it was uh, as in surprisingly a good experience for me.
Yes, in last 2 years, we had seen many cases when people had gone through a very difficult phase in relationship with their parents, spouse, or even children. Even in leadership population, we had seen people had difficult time with their parents because during lockdown, there is no thin line between your professional space and personal space. People have completely lost it. They are bound to stay in a smaller place and they really feel restricted. And despite being with many people at home around them, they feel lonelier because everybody was struggling their emotional challenges at home with restricted life and mindset, which have created a huge impact on relationship with the spouse and with parents, because everybody was trying to control each other. Children felt very lonely, specifically, the teenagers had gone through a very difficult time. Most of them were exploring their own personality where they got stuck at home and they couldn't connect with their classmates, their friends. They have been creating, their fake identity on Insta and other platforms, and were questioning themselves throughout. So this is really being a very difficult time for individuals once it is coming to their relationship with others.
So, during COVID times, I experienced fluctuating mental health, and I had one of the longest depressive episodes during the second wave of COVID, which extended for 3 months, and I gained about 5 kgs in that lockdown. And after a point of time, it had become impossible for me to just move out of my bed. So I had to force myself to see a doctor.
Uh, Initially, it was very nice because we could work from home, and first couple of months were very nice when we learned about COVID and how to tackle with it. But as the time goes on, because in my field I'm working from home from past 2 years, more than 2 years now. So now I need to interact with people because I am a person who wants to hang out with other people, who wants to meet new people, but I cannot do that. So my mental peace and like sometimes want to express myself, and I don't get enough people to whom I can interact with, and that has made me little lonelier. Sometimes I never felt this way before COVID.
In terms of my mental health, I think because of this opportunity to reconnect with so many friends and to talk to them, I think overall it had a positive impact on my mental health. Although the experience of say being stuck at my place, at times it would get on your nerves, particularly because I am a kind of a person who wishes to step out for say physical activities. I was into running, and my running regime totally came to an end. So those things, as in they were the irritating part, and it did have an impact on me.
There is a high surge in mental health cases. At Antarman, we only witnessed 12 times more than what pre-COVID, and especially the second wave. There was no time for breathing space for us also as being counselor. We have a huge team, but each counselor was so busy having somebody also sick at their own family. They were also going through grief and loss emotions, and they were trying to help people who were going through that. So we had seen a very, very high surge in mental health, and we are still noticing. We are still seeing it. It is very high. The good part is that now people are becoming aware about it, and they are seeking and reaching out to help. I think before COVID, mental health issues were under carpet. So this is just that we can't say that it was never there. It was always there. But COVID, this pandemic, helped them to realize, accept and acknowledge. They become aware about their mental health, and now they are openly reaching out to help. And families are also supporting their family members to seek help for mental health. So this is a positive sign, but there is a long way to go once it is coming to handle mental health on a very deeper and grassroots level in India.
No, I have not had any suicidal thoughts during COVID lockdown. Thankfully, I've had support of people around me, but yes, I know a lot of people who were so scared, who lost their loved ones, that they thought of taking their own lives because they did not see any hope left.
Self-harm. Yeah, I have started to overthink a lot. I've always been an overthinker, but now since there is a lot more time since I mentioned in the last question that I get lonelier. So when you are lonely, you think even more. And when I overthink, I am a kind of person which think almost to the extremities of all the situations. So I think in that scenario, I think all the situations to the very end, like how bad they can go. I can think like that, and then I think that is harming my mental state as well.
As to self-harm, I don't think so. There was no self-harm behavior induced due to COVID. That's not has been the case in my experience.
In India, we had seen more death with suicide than coronavirus in last 2 years, and that's very, very painful. Besides that, once it is coming to suicidal thoughts, and there are many reasons. There could be loss of some dear ones, poverty, and lack of money, and sometimes it is depression. Interestingly, depression and mental health contribute very little to actual suicidal cases across the globe. But it's a high time that we start taking true charge of our own mental health. Whether you are in a school, you have school counselors. If you work, most of the organizations are providing EAP helplines where you can reach out and talk to an expert and seek help. If you're a general public, government and other hospitals have enough counselors now, and one can go and take appropriate measures for handling their mental health. and even if it is coming to their families, it is important that we acknowledge the importance of mental health and build a support network for them.